Hello, my name's Rhian Noble-Jones and this is an education needs project around genital edema or swelling, and particularly the surprising international impact we had from what was just a small local project initially. This international project developed from an education service development in Wales. It was funded by Tenemis Cancer Care, and we partnered with another charity, International Lymphedema Framework, to work on content validity and distribution. About genital edema briefly. Genital edema can occur in men, women or children. It can have a profound physical and psychological impact. And is normally treated in this country by nurses or therapists who've done some post-registration training in lymphedema, and some will have done supplementary training specifically in the management of genital edema. We don't know about the prevalence of it, and that we don't know whether that's because people just are too embarrassed to come forward with it, whether health professionals don't recognise it, or whether they don't know where to send the patients for treatment. But our previous research showed that the conversation is a difficult one to start for both the patients and health professionals, and we sought to address that in some way. Initially by designing a form that would start that conversation off, and then pragmatically by trying to address the education needs. So this was a mixed method investigation concerning genital edema or lymphedema in men, women and children, the population being health professionals who conservatively, not surgically, manage genital edema using an electronic online survey in English and French during autumn 2019, and followed by focus groups in Wales, England and the USA. So the survey collected the demographics of our respondents to check we'd targeted the right people, their normal practice, how confident they felt about it, what they felt the subjects should be in genital edema supplementary training if they felt it should be there at all, and how essential some suggested subjects that we gave them were. Then identify their top 3 education needs and how they should be delivered. And then this was followed up by focus groups to look at the contextual issues for them that brought about the education need. So here are some key findings. Here we compare the international to the UK respondents. Specifically for Wales, for example, we had 30 of 40 lymphedema specialists responding, giving us a 75% response rate. Although internationally half the respondents were physiotherapists compared to only 5th in the UK, the trend of most of the findings in terms of practice and education need were surprisingly similar. Respondents internationally and the UK confirmed a perceived delay in identification and referral of these patients to lymphedema services. And despite between 42 and 49% of respondents having completed supplemental genital edema education after their original lymphedema training, only 2% of all the respondents in the UK felt current education was sufficient to manage, and internationally that was only 5%. So there clearly is an education need on this subject. Very few respondents used assessment documentation specific to genital edema or any sort of treatment algorithm to guide the treatments for these patients. And treatments tended to be skincare, compression and specialist massage that were transferable skills from treating other parts of the body with lymphedema. Although there were some onward referral that were more specific, such as reductive surgery, lymphatic surgery and sexual health, mental health, that were appropriate. So in terms of education need, we first asked about their confidence, where they went from not confident at all to very confident, with 2 being the midpoint of somewhat confident. And here the population is split by whether they've had genital edema training or not. The yellow being those who have worked in the area of lymphedema for over 10 years. And you'll see there's not much difference between those 2 groups. But when we look at the ones that are less than 10 years in training, the orange and the grey groups there, you'll see that there is a significant difference between those who've had genital edema supplemental training and not. And we could split this by particular subgroups or subtopics to see which particular topics there was the greatest difference in confidence levels. And that gave us an idea of the content you might put into a course. And this was despite the fact that for most of these, their supplemental genital edema training had only been between 1 and 4 hours. In terms of what respondents thought was essential to include in education on genital edema, unsurprisingly, skin care, compression garments, specialist massage came high. But also the common pathologies behind it was a key thing for 9 out of 10 respondents, as was the difficulty in overcoming conversations in this patient group. And in terms of their own personal needs, here we had 1,200 open text responses to analyse, but still the difficulties of applying compression to the genitals was a real issue for 70% of respondents, as was supporting self-management for patients. But here the patient assessment and the clinical reasoning came out almost 50% of respondents as a top 3 need for them. And that's something that wasn't identified previously in any training. And it may relate to the fact that 83% of respondents haven't got that specific patient assessment tool to use to guide their treatment in this patient group. In terms of the format of educational resources, there was a desire for multiple formats, both online and offline. And this helped to give us guidance as to what we might develop in terms of output, but also it gave us something to follow up in the focus group in terms of what exactly people needed. So the focus groups were held in Wales, England and America, with a total of 69 nurses and therapists who regularly deal with lymphedema, and some of them dealt occasionally with genital edema. And the key points were that yes, indeed, referrals were late, but they felt that the education needed to happen to frontline GPs, doctors, nurses and allied health professionals. That differential diagnosis was difficult, and particularly because these patients often have a complex picture, and that there was no validated tool or algorithm to help them in those clinical decisions. So there's another need. That there was also a need for better products to help the patients self-manage their condition, and particularly in Wales they felt that PROMs and PREMs would help them ensure that the care they gave was of value to the patient. In the American focus group, there was an issue with the pay system affecting the way that they could deliver their care, and they couldn't deliver it earlier because with preventative measures. But that also all groups identified that self-directed learning, which was how it is now, needed support. So they needed the online learning resources, but they also needed opportunities to shadow specialist clinics, and they needed those supplementary specialist courses to be there for them. So we anticipated a lot of outputs from this project right from the start, specifically designed to improve the care of patients with genital edema in Wales, of course, originally. But the outputs were far more than we anticipated in the end, and are still ongoing. We have brand new specific assessment forms, we have pocket medic videos, we've done webinars for patients and professionals, not just in Wales, but internationally. We have brand new e-learning packages, and we're about to start on a differential diagnosis algorithm with experts from around the world. For all of the outputs of this project, we had implemented or had planned measures of capturing impact, such as measuring uptake, evaluations, downloads, that sort of thing. What we couldn't have anticipated was just the level of interest internationally in this project by the number of responses you saw, but also in the outputs. And consequently, a lot of the things that we've now developed for Wales have actually been integrated into various projects internationally and are impacting on patient care all around the world, which is really satisfying and pleasing to us. Thank you very much for listening, and if you have any questions, please do get in touch with us. Diolch yn fawr.